average doctor is absolutely not going to have any desire to do an EMR migration, right?
Right. And do you think trust is also a factor? Like one thing we keep hearing is that doctors are hesitant, not because they don't want innovation, but because they don't fully trust what is being built. And then there is a human life and human care is involved, and they wanted to be really careful over here. Do you think the trust is also a problem here?
It's all usable. Right now, we're seeing this explosion in AI tools, AI widgets, AI plugins, integrations, add-ons, and they're all usable. They're all helpful. I'm excited for AI that can take an asynchronous telemedicine visit and craft the S and the O portion for a doctor. There's a lot of telemedicine that uses ambient listening, and none of them are used. Talk with 200 doctors about their workflow. Create something that allows you to get useful information from the consumers that you're trying to build a product for, so that you don't have a swing and a miss and develop a technology that doesn't exist 5 years from now because it was a gee-whiz solution that fizzled out because it didn't have long-term staying capacity.
Welcome to Better Health Tech, where we explore how technology can actually make healthcare simpler, smarter, and more human, not just more complicated. I'm Muhammad Atif, CTO and President at Biologics and BetterTech Health, where we focus on building custom healthcare and enterprise technology solutions that solve real operational challenges. Today, we are diving into a challenge every hospital, payer, and health tech company is facing: how to adopt new technology without adding more complexity, more stress, and more friction to already overloaded teams. And to help us unpack that, we have a very special guest with us, Dr. Laura Purdy, founder and CEO of JellyMed, board-certified physician, and someone who has been deeply involved in telemedicine, clinical strategy, and building systems that actually work in the real world. Dr. Laura, it's great to have you here.
Well, thank you for having me here. I'm looking forward to the conversation.
Well, thank you. So, Dr. Laura, before we jump into the topic details, if you can tell us about your journey and overall experience, that will be great for our audience.
Certainly. So I'm Dr. Laura Purdy. I'm a board-certified family medicine physician. I also have an MBA, and my background is interesting. I served in the military. So the first 15 years of my professional career was spent serving the military and as a physician. And in the last 5 years of that, from 2017 to 2021, I worked in telemedicine, in the telemedicine industry in the United States. I held several executive positions at companies you've probably heard of. MD Live, I was the first practice medical director there. I was the owner, the president of the medical group of Hims and Hers for 3 years. And I was the chief medical officer at Open Loop Health for a couple of years. And now I own my own national medical group and telemedicine delivery company called Exalara. And the brand that you referenced, JellyMed, is specifically telemedicine for the music industry. So I don't know that we will talk too much about that particular brand today, but the primary company that I run today is a national medical group called Exalara, of which JellyMed is one of the sub-brands.
Awesome. Great to hear about your complete journey, starting from the military and then serving as executive top leadership into different Fortune 500 companies and top players, and then running your own venture. So really excited for this one. So the topic that we are discussing today is building AI that doctors actually trust. So let's start with the base. AI is everywhere, in the healthcare right now. If we talk about documentation, diagnostics, workflow, if we talk about decision support. But from your perspective as a clinician, how much of this is actually usable today and how much is still it's a hype?
Well, it's interesting because I've been a practicing physician for 12 years. I've been licensed for 12 years. So I would consider myself to be a mid-career physician, and I've been a healthcare administrator since 2014. So my first job out of residency was administration in addition to care. So I am an administrator, and I've been an administrator the entire time, we'll say. Okay. So I consider what's happening with AI right now to be exactly like what we saw in the digital health tech revolution. I was one of the first 50 state licensed physicians in the United States and one of the pioneers. And so the answer to your question is the AI usable? The answer is, of course. It's all usable. Right now, we're seeing this explosion in AI tools, AI widgets, AI plugins, integrations, add-ons, and they're all usable. They're all helpful. And every system that we use in mainstream or cash pay non-traditional healthcare, which is where I work. So I've spent zero time in traditional healthcare. I went from government to cash pay, right? So
Right.
cash pay virtual. So I have not had the experience to use the major insurance-based EHRs. But I think from the physician side, it's really overwhelming. Most physicians are not connoisseurs of technology. They have not worked in the digital health tech industry like I have for 10 years. They have not worked at tech forward, tech enabled companies. And most of them are only familiar with the tech system that their systems use. So I think for most clinicians, I'm going to say average clinicians. And when I say average, what I mean is average understanding of technology, average understanding of progress, average understanding of how to use AI. I think it's overwhelming and it's too much for the average clinician to even be able to consume, because while all of the AI technologies are useful and they all do something that we need, figuring out how to adopt them and how to implement them and make the doctors' lives easier is actually not that easy in practice.
Got it. So according to you, like, is it more of that these systems are not built as user friendly as it should be? Are they too much like disconnected? Where do you see is the like main problem in this overall?
From a doctor's perspective, I think the problem is twofold. Number one, some of the AI solutions that are built in a vacuum. They solve one problem, but they don't solve the problem in the context of other systems. Integrations have improved. APIs have absolutely improved. Usability has improved. But again, the average doctor is not going to understand how to integrate your AI solution into their existing platform. And the average doctor is absolutely not going to have any desire to do an EMR migration, right? Like I've done that twice in my own business and I never want to do it again, although I know I'm going to have to when I build my own someday, right? But the average doctor is not going to do it. So most AI solutions are built, in my opinion, at a level that doctors don't understand. And it's not made clear to them upfront in the sales process. It's very tech forward language. It doesn't speak to doctors in languages that they understand. And it's not something that's easily to implement, easily to put into practice. And if the practice is owned or operated by the physician, not someone like me who's a physician administrator, they have no idea and they get intimidated and overwhelmed by the solution, which results in no solution.
Got it, right. And do you think trust is also a factor? Like one thing we keep hearing is that doctors are hesitant, not because they don't want innovation, but because they don't fully trust what is being built. And then there is a like human life and human care is involved, and they wanted to be really careful over here. Do you think the trust is also a problem here?
Certainly. I mean, we have fear of HIPAA, right? We have fear of accidentally breaking federal law by using a tool that's not as secure as we think it is. They also have a fear of being replaced. I mean, I'm sure you know this. In Utah, for some reason, the medical board has approved of AI refill prescribing. Most doctors of this generation, and let me put a disclaimer right now. I am only speaking about the trends that I have directly heard from clinicians. This is not necessarily my own opinion. This is what I've heard. So I'm speaking on behalf of the thousands and thousands of doctors that I've interacted with or been the manager or president of the medical group, the boss of over the last 10 years. Most doctors of this generation who are as far into their career as I am, or maybe within 20 years of me, have gone through what it felt like to feel like their jobs have been replaced by nurse practitioners and physician assistants. A lot of doctors in a lot of places have been replaced by less expensive less expensive workforce. And that is in their opinion. Now, to present the other side, just because I don't want to upset anybody, I know that nurse practitioners and physician assistants can have higher patient satisfaction scores, better adherence to protocols, algorithms, more efficiency, and less error rate. So I'm not knocking that. I'm talking about the doctors that have a perception that they've lost work, lost income, and lost job opportunities because of nurse practitioners and physician assistants stepping into their role. So I think that there's a lot of fear in physicians, especially physicians that have been doing this as long as I have, or maybe 10 or 20 years longer than me, that now that AI is doing healthcare, like we see in Utah, they're going to lose their jobs. They're going to have less opportunity. There's going to be less doctors needed to provide the care because, sure, you're always going to need somebody laying hands on. But if the lower acuity stuff is being funneled to tech enabled doctors, what happens to the physician workload right now? And I think there's a very real fear, in addition to the fear of cybercrime, the fear of leakage of HIPAA, the fear of, whatever. I do think that fear is there as well.
Got it. And do you think like this is going to create more problem for entry level professionals who are coming to this industry after graduating from like colleges or universities, or is it more for the experienced one?
Oh, not at all. Because what's happening is just like what we see with technology, right? I'm an older millennial, so I am not a digital native. I'm a digital pioneer. And my children, who, the oldest is 12, they're digital natives. They don't even think twice about anything related to technology, right? And that's what's going to happen with the doctors and nurse practitioners and PAs, anyone who's delivering healthcare that's coming out of school. They're going to go right into the industry, and they're going to be AI healthcare natives. So they're going to learn how to do it in school. They're going to practice using it in their clinical sites when they're doing their rotations, and they're automatically going to adopt the workflow, the lifestyle, and the career. They're going to build their career around it. Whereas the rest of us that have been around a while, we're the ones that have to make the real changes. We are the ones that have to decide where we fall on the adoption curve. Do we never adopt and just use paper charts until we die and go out of practice? Yeah, there's going to be people that do that. There's still doctors that do paper charts. Are there going to be people that say, I don't do that AI stuff? Sure. And their practice will die with them probably, right? I'm not trying to be morbid, but this is how it happens. We're undergoing a technological revolution, and the people that don't adopt will eventually be phased out. And the people that come in using the tech from day zero represent the new generation of post-revolution workforce.
Yeah, but I think since it's involving the human care and being as a patient, like if I'm going to a clinic or hospital, I will be having more trust if I'm meeting a human who is like treating me instead of some AI robot who is talking to me. I may not feel that comfortable or that level of trust on that. So I was also hearing that yesterday that government is going to govern a body who is going to keep an eye on all the AI LLMs that are being released to ensure the security and cyber stuff, and also at the same time the job security as well. So what do you think, like from the patient point of view, also should the government like step in and should try to regulate this industry, or they should let the innovation happen?
It's going to have to be regulated because we're handling patient data. Anytime anything touches patient data is regulated at the federal level, period. And that's not my opinion, that's the fact. Now, what is regulated at the state level is the establishment of the doctor. And when I say doctor, I really mean clinician. So clinician-provider relationship and authority to prescribe. Now, I don't get to decide what the states choose to do. The federal government is going to have to come in and provide regulation anytime controlled substances, because that's regulated by the DEA, payment, right? Insurance, if insurance is paying into, that's federal. If it's Medicare or Medicaid, I guess is that the state. And then, but if it's TRICARE, VA, that's all government, right? And then number 3, it would be the states. So if the state says, we will allow AI to prescribe in the setting where a valid doctor-patient relationship has been established, a valid prescription from a doctor-patient relationship has been dispensed, et cetera, et cetera, et cetera, et cetera. Then we will allow the AI to do dispensing of refills if certain parameters are met. That's great. And I hope that they do. But yes, the states are going to have to get involved at the regulatory level as well, or the people who are building and executing these AIs to prescribe medication with no real doctor involvement will be aiding and abetting the unlicensed practice of medicine by a non-licensed individual. That's a crime. So it is definitely hype and fear mongering that people are saying, oh, they're going to replace the doctors and patients are never going to see a human. The regulators don't allow that. Even in telemedicine, there's still some states that force you to have a video visit. That's an archaic thing and it's not really necessary. But the regulators are never going to say, no doctor needs to be involved anywhere. We're going to give robots licenses to practice medicine. Now, robot, you are regulated by the Florida. I'm in Florida. So now AI, you are now regulated and held accountable to the Florida Board of Medicine. No. Now, what I do think will happen is that the businesses will be held to a higher level of scrutiny. The businesses that are coding, developing, running, selling, maintaining, and having access to the data, the businesses should be regulated because the behavior that they choose to take and the choices that they choose to make when they are making AI software that touches patient data or assists in delivery of healthcare, there should be huge consequences for making the wrong choices there. So I hope it's federal regulation for the data, state regulation for prescribing authority, and state level regulation for the business practices, which is really what it is right now anyways.
Got it. So let's really dig into the AI use cases. So from your experience, have you seen like any use cases where AI tools really look great in demos, but it failed in actual like clinical environments?
No. But the reason why my answer to that is no is because I'm a healthcare administrator and I run a national healthcare delivery company. So the AI tools that I use AI note takers for meetings. I use AI video editing software for social media. I have an AI co-founder because I'm a digital health tech founder. So my business, like my job, looks more like a health tech founder than a doctor, right? So I don't own and I did not build the tech system that my business runs out of. So we use AI prospecting software in our sales department. We use AI in Stripe, which is our payment processor. But I don't have any experience testing or running AI clinical softwares because that's not relevant to my job.
Got it. So tell us more about this venture. Like, is it more of kind of a networking opportunity for the people, or it's a same-minded people who are driving the next wave of with the tech to our audience?
No, I run a national medical group. So I have a national medical group of doctors and nurse practitioners. Our business is registered to do business in all 50 states, and we provide them work. So it's kind of like a locums company, but we provide clinical back end for non-physician owned clinics, such as med spas, IV hydration companies, and all cash pay. Or we can provide the clinical back end for non-physician owned telemedicine companies. And we have 3 consumer brands. So we also run our own virtual clinic. So it's a medical group that engages in direct to consumer care, as well as business to business medical group services. So it's medical group as a service is what it is.
Got it. Right. So Dr. Laura, so like if you have to give advice to these like companies who are building AI for healthcare today, so what are 2 to 3 things top of your head that they should be focused on?
Item number 1, you need to focus on not going to prison. Okay. And I say that because I've been in this industry for 10 years and I've known a lot of people who've gone to prison. And I don't know if they went to prison because they did something wrong on purpose or if they did something wrong on accident. But what I can tell you is that when you work in this industry, especially if you are working with prescriptions, patient data, healthcare information, it's real easy to accidentally break the law if you don't know what the laws are. So that leads me to advice number 2. get a good healthcare regulatory attorney. In fact, I think you need 3 attorneys. If I was going to start an AI clinical support, decision tool company tomorrow, I would get a healthcare regulatory attorney to help me understand the state and federal laws that apply to the care delivery. I would get a healthcare data privacy law attorney, because that is a very specific subset of law that you need to understand. And my healthcare regulatory defense attorneys do not understand that. Number 3, you need a good business attorney to help you with things like your cyber insurance, right? Your general liability for your business, because you are going to need to layer multiple layers of legal support. In all of the instances where I've known people over the last 10 years that have gone to prison or are going to go to prison, it was all avoidable. It was all avoidable. It was never, the law didn't say that, or it wasn't really obvious. I didn't know. I couldn't tell. No, it's actually very clear and you can tell. So that's advice number 2. Advice number 3 is talk to the people. Don't just sit out there in your gee whiz think tank and come up with some brilliant idea that you think everybody's going to learn because you went to the doctor one time and the doctor was facing away from you and looking at a screen. And so now you've decided that you're going to make an AI scribe. No, one of the worst decisions a founder of any kind in any industry for any reason can make is to solve a problem that doesn't really exist. So talk to lots of doctors. Like, don't wait until you develop your product to then force them into a beta test to try to tell you that, okay, it's probably fine. Talk to them up front. Talk with 200 doctors about their workflow. Create something that allows you to get useful information from the consumers that you're trying to build a product for, so that you don't have a swing and a miss and develop a technology that doesn't exist 5 years from now because it was a gee whiz solution that fizzled out because it didn't have long-term staying capacity. Those are my top 3 pieces of advice.
Well, thank you. I think this was really insightful. So let's have a quick rapid fire.
Okay.
We'll just keep it short and you can answer like instantly whatever comes to your mind. So one AI use case you're excited about?
I'm excited for AI that can take an asynchronous telemedicine visit and craft the S and the O portion for a doctor. There's a lot of telemedicine that uses ambient listening, and none of them are useful. And that's part of the reason why our clinic doesn't use them, because we do a lot of asynchronous chat, and a good asynchronous visit has a lot of dialogue between the medical team and the patient. Sometimes it can even take a couple of weeks for the patient to come to a decision with the doctor of what medication they want. And so if I could have an AI software today that could do that for me, now I would immediately adopt. But one doesn't exist yet that I know of.
Got it. Build versus buy. What should hospitals do?
What should hospitals do? Hospitals should hire a consultant, because hospitals are institutions and they don't have the capacity to understand the innovative care industry and what's going on my side of the playground. My side of the playground is fun and exciting, but completely foreign to people in mainstream healthcare. So they should hire a consultant like me. I do that. I actually do consulting from someone who understands the industry to help them implement a good solution that is a good use of their resources.
One thing overhyped right now.
Well, if you can find it on Instagram or TikTok, it's probably being overhyped. I'm just going to say that. Now, that is an overgeneralization, but I want you to understand that when people create viral marketing campaigns on Instagram and TikTok, they are using known psychological sales tactics to purposefully hype you into immediately buying their thing. So if you're seeing it on social media, just believe that it's overhyped and don't believe everything you hear, but definitely book a sales call, talk to the sales team, do like 3 or 4 due diligence meetings before you make a big purchasing decision. Because if you're finding it through social channels, just inherently it's going to have hype built into it. That's how it works. The hype is what gets your attention.
Got it. And what's the one mistake you see most often teams are making when implementing AI or technology in their healthcare?
I would say one mistake is underestimating the amount of support their workforce needs to adopt the change. how long it takes, how much confusion is going to be there, and just how hard it's going to be. So companies, institutions need to make sure that they're allocating the right amount of time and resources and assistance, because adoption at any level, whether it's a single Botox clinic wanting to use AI to help them do their notes, all the way up to hospitals and health systems, you got to get everybody on board at the same time. And creating organizational change, especially when it involves technology adoption, is very hard, and you have to devote a lot of resources to that.
Awesome. So thank you, Dr. Laura. This has been really insightful conversation, especially around the privacy guardrails and practices that you mentioned. And before we wrap up, what's the best way for the people to reach out to you or connect with you?
The best way is through email, Dr. Laura at Swell Care. That's our legacy brand email. So SWELL care.health. You can also find me on Instagram. I don't check the DMs as reliably. We're still working on setting up that AI automation with that software. But Dr. Laura Purdy, Dr. Laura Purdy is my Instagram handle. I'm also on LinkedIn. I'm on TikTok. You can find me on Facebook as well. It's the same name everywhere. It's like bright red hair. You can't miss it. So we're standing by to help anybody who's doing telemedicine. If you have a clinic, if you need clinical back-end support, that's what we do. So thanks for having me today.
Yeah, thank you again, Dr. Laura, for joining us. It was really nice to have you. And to everyone listening, if you are building, using, or thinking about AI in healthcare, remember, tech only works when people trust it. Stay tuned and don't forget to follow our page and subscribe to our YouTube channel. See you in the next episode of Better Healthcare. Thank you.